This is the Fertility Friday podcast, episode number 62. Welcome to the 62nd episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from FertilityFriday.com, and this is your source for information about the fertility awareness method and all things fertility. If you've been enjoying the show, I would love it if you take a moment to leave a review and a rating in iTunes. It helps the show to move up in rankings so that more people can find it. And if you haven't yet subscribed to the podcast, make sure to subscribe so that you'll never miss an episode. If you enjoyed today's episode, please stop by the show notes page and leave a comment. You'll find all the episodes at fertilityfriday.com/podcast, and you can also find me on Facebook at facebook.com/fertilityfridays with an S, and you can find me on Twitter at fertilefriday. And in 2016, in January, February, I'll be opening up my schedule to see clients. I'm so excited to be offering fertility awareness support and education. I have a limited number of spaces available, only 2 spots to be exact per month at this point. So if you're just learning about the fertility awareness method and you're feeling overwhelmed and you want somebody to walk you through the basics, I have an introductory program. So just shoot me an email at info@fertilityfriday.com so that we can schedule a 15-minute meet and greet, and we'll figure out if we're a good fit. And in today's show, I'm very excited to welcome my guest, Jani White. Jani is a senior acupuncture practitioner in London with over 17 years of experience in the field. Jani specializes in acupuncture for fertility, pregnancy, childbirth. She teaches courses in London for expecting parents, new parents, prospective parents, teenagers, so the whole gamut. She teaches about the importance of preconception care, how you can maximize your body's capacity for normal conception, how to improve your chances of assisted conception, and so much more. Jani also has a book series coming out right about the time that this episode is airing, so end of January, beginning of February 2016. So I'll let her tell you more about that. And in today's show, we'll be talking about the importance of acupuncture for menstrual health, the role it can play throughout a woman's life. So not just when she's trying to conceive, but in her teen years, conception, as well as perimenopause, menopause. So we'll be getting into it quite a bit today. So without further ado, welcome to the show, Jani.
Thank you, Lisa. Very pleased to be here.
Oh, thank you so much for coming on the show. I'm super excited to have you. And so I gave you a brief introduction, but with your wealth of experience, having been in the field for so long, I'm sure I barely scratched the surface. So I'd love for you to take a few minutes and introduce yourself, talk a bit about your background, even how you got into acupuncture in the first place. And also you could tell us a little bit about your book series coming out.
Thank you. Oh gosh. Well, I guess we'd have to go back 26 years really to cover what's been happening for me career-wise. So my maternity experience really began there. I always include that as very much a part of what it is that I bring to my practice. So although I wasn't qualified as an acupuncturist at that time, I did have a really interesting experience of being a Canadian transplanted to London. I didn't know anybody here in the UK, and I was pregnant, and I needed to forge into the maternity services all on my own. And it never occurred to me that I wouldn't have anything but a home birth. And this was 26 years ago. I had to fight tooth and nail. And it was a really strong learning curve that actually then hugely impacted on the choice of the kind of practice that I want to have. So maternity, everything obstetric has always been at the core of my practice. Fertility kind of came and found me. I wasn't actually looking for it. But again, this is going back a lot of years and back to a time, certainly in the UK, before IVF was something that was available on the NHS. And so it was something my colleagues and I rarely saw, particularly the assisted conception support. When the NHS, National Health Service, made IVF available, so this means that people were able to pick up a cycle of IVF without needing to pay for it, suddenly the work that my colleagues and I were doing became really very important and really valid. And I was just very fortunate to be in on the ground floor and really working to discover what it is that we can do with acupuncture to be able to support assisted conception, which put me personally on a crash course for learning about the endocrine system and really learning to understand how our hormones govern conception in particular, which meant that I have spent the last 17 years studying the endocrine system, studying the reproductive system. And so over the years, that interest has developed and grown and very much expanded. And I became extremely interested in men's urogenital health about 10 years ago. So this is another one of my specialties. And then just in the last few years, I've been very concerned to reach out to the teenage community and really help them to start considering about future-proofing their fertility. I don't know how it is in the States, but here in the UK government, for the first time, has written infertility into the population projections. And the UK government anticipate that by 2020, which is only 4 years away, by 2020, they anticipate 1 in 3 couples will be having a fertility problem. So this is just, I think, a really crazy, crazy statistic. And it's really given me a huge inspiration to want to really reach out to younger women to talk to them about their menstrual health. And in the context of their menstrual health, to really be considering the choices they're making in terms of birth control towards understanding how that might affect their fertility. So
That
that's
statistic is
it's
haunting. One in
it's
three
just
couples.
awful. It's just awful. So when people ask me, oh, so Jani, what do you do for a living? My usual answer is just hormones. I do hormones. That's what I do for a living, which I love. And so, I'm really pleased by your invitation to join the podcast and to have the chance to really talk to your audience about, well, what does it mean to have a healthy period, whatever your age may be? And how is it that acupuncture in particular, acupuncture and Chinese medicine, meaning herbs as well, can really help to improve your menstrual health?
Well, let's get into that because that's something we've talked about on the show quite a bit. And I think one of the reasons that I always come back to menstrual health, obviously because it's related to the menstrual cycle and fertility awareness, but I often say that many women don't really know or have that context of what a healthy menstrual cycle is supposed to look like.
Here,
Often,
here.
yeah, because there's so many different concerns that many women have with respect to their menstrual cycle. So whether it's painful periods, whether it's irregular periods, or whatever the case is, to the point that it's so common that I think women think that these things are normal and to be
This
expected,
is the
right?
problem. This
Exactly.
is the problem. They're not to be expected. Maybe that's a really nice place for us to start, is to say to women everywhere, any age, that actually, a normal menstruation is something that should bring a modicum of fluid retention, that should maybe offer you just a slight achy feeling just before the onset of menstruation, and that there may be some slight bowel changes. It's not uncommon for the bowels to get slightly looser before the period, but really, those are pretty much the only symptoms that I would categorize as normal symptoms of menstruation. Maybe a little bit of breast tenderness, but nothing that feels bruised or uncomfortable or that would cause you to need to wear a bra because the breasts are so heavy, or to take a bra off because it's so uncomfortable. So, there's a spectrum of the way that women experience their periods, but I would really like to categorize to everybody just that handful of symptoms: very slight breast tenderness, a modicum of some fluid retention, maybe slight changes in the bowels being slightly looser, and a little bit of an achy discomfort prior to the onset of menstruation. Those are really the only 4 symptoms that I would consider normal. And I just think it's really sad that we live in a society where the majority of women are certainly having much more uncomfortable symptoms than that. bang up a couple of Nurophens, pretend it's not happening, carry on with work, even though actually what those symptoms are saying to you is, excuse me, could you please lie down? I'm really struggling to do this period here, and actually I need you not to be carrying on as normal. And I don't know, I've heard you mention it on a couple of podcasts, and this is a beautiful story for any of your listeners who haven't come across it. A wonderful book called The Red Tent, written by a woman named Anita.
Diamond?
Thank you.
Diamond? Yeah, I think that's her last name.
Wonderful, wonderful stories set in biblical times in Bedouin society, and in a time where, in that kind of tribal life, the red tent was erected when the camp was made. And when women were on their menses, they would go into the red tent and they would sit upon straw on the ground. And for the duration of their menses, they would sit in restful contemplation and just allow the menses to flow into the earth. Now, this is absolutely as beautiful as a way we could spend our period as possible. Unfortunately, perhaps not really very viable in our modern society.
Yeah, well, that book it's honestly one of my favorite books. And the reason for it is, if you've ever read a book where you get so enmeshed in the story that you don't want it to end, and you reach the end of the story and you just want it to continue. So one of the things that really struck me in that book was the female companionship. So, as much as you could look at it as though women were segregated from the men when they were menstruating, it's not like that in the book at all, because they were able to just spend time with each other and really just enjoy all the things that were feminine. And it also had to do with birth, and it was always such all of these special moments that you got to share with other. So anyways, we're plugging the book, but if you haven't read the book, it's amazing.
Absolutely, and just to pick up on exactly the point you just made about living in community, the menstrual cycle, the inverted commas normal menstrual cycle, is 28 days. It's a lunar cycle, and that in this sort of a lifestyle, most women would have their flux on the lunar cycle, and the reason for that, and this is something that I have experimented with for the whole of my acupuncture career, and I do have great success with, which is that when I'm connecting with women who have amenorrhea, meaning they're not having any periods, that what I do is I start treating them according to menstrual phases, which I'm about to explain in a minute, and I will treat according to the lunar cycles. And the way that we should, in a very natural rhythm of lunar menstrual cycle flow, is the period should be on the dark moon. This is the time of the least magnetic draw, and this is when our body should go into its downward tide and release the endometrium. So we're in flow on the dark moon. And then as the dark moon begins its waxing process, that means the dark moon is getting bigger and bigger and bigger, all the way up to the zenith of the full moon. This is our follicular cycle. And that it's at the full moon when we have the greatest magnetic pull on the earth. This is when the tides are at their very highest, because we have this significant draw. And that legend that more babies are born on a full moon, this is absolutely true. Ask any midwife, and they will tell you full moon nights are always the busiest labor wards of the month. And this is the time when we should be in the rhythm of our ovulation, that magnetic draw is helping to pull that egg from the follicle. And then we go into the waxing moon. So the moon is getting smaller and smaller and smaller until it comes back down to the dark moon. And this is the luteal phase. So thinking about the red tent and the story there, it would have been quite common in that sort of a society for women to be in a similar menstrual rhythm, because they would have been very attuned to the lunar cycles. And the thing you were just saying about community, I think, is incredibly important to draw upon, because in that sort of a community, And the same would go for living in an African compound or in a First Nations teepee village, anywhere where we're living in that community, where we have women of all stages and all ages within the community. There are women who are there to tend the fires or to take care of the toddlers when mothers are having their babies. These women who go into the red tent spend the days leading up to their menses preparing foods in advance. So there's this whole sense of actually preparing to take that time out in order to have that restful downtime of the period. Well, we don't have that luxury in our society, do we? Irrespective of your period, you still have to stand up and commute and go to work and sit at your desk and meet your fulfillments and requirements at work, and then get home and you still have to cook your dinner and da 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 da. So one of the things that we've really lost in our society is that capacity to move with the rhythm of the phases. And so I'd like to bring that round to talking about acupuncture for menstruation. So this is irrespective of fertility. What I'd like to really address today is healthy menstruation. This is especially important to women who want to conceive, because the healthier your menses is, the clearer the indication is that we have a very strong, vital, and healthy environment for that conception, implantation, and gestation. And please never forget that your period is always a reflection of your total health, as is your libido.
Well, I'd like to expand on that a little bit, because one of the things that I wanted to ask before we kind of get into, because that's such an interesting topic, acupuncture throughout all stages of the menstrual cycle.
Mm.
I wanted to ask how menstrual pain and menstrual just just menstrual pain and all of those dysregulated menstrual irregularities, all of those types of things. How is that looked at from the perspective of acupuncture?
Okay, let me just think about what's the easier way around for us to explain this. I think what I'd like to say is I'd like to start with actually explaining the phases, and then I'd like to talk about dysregulation, if you don't mind.
Yeah, no,
So,
that's
the way that we look at it in Chinese medicine, the menstrual phases, so phase one is menstruation, and this is understood as the discharging of the lining of the uterus. And so during this time, we have a downward tide. So the cervix opens, the cells of the endometrium open, the blood is discharged, and there is the menstrual flow out of the body. And then, as the lining is completely discharged, the cervix closes up. And as that happens, the tide within actually changes and moves so that it's going out through the fallopian tubes and towards the peritoneal cavity. So, as you know, the fimbriae are at the end of the fallopian tubes, and they're not attached to the ovaries. They actually are there to encapsulate the ovaries. But what we do have with this wonderful design is the means for this tide and flow of all the different fluids that generate the balance within the whole of your gynecology. It's so interesting. In Chinese medicine, the word uterus, the Chinese character for uterus, encapsulates the ovaries, the fimbriae, the fallopian tubes, the womb, the cervix, the vaginal canal, and the external genitalia. So in Chinese medicine, that's all just one thing, and it operates as a completely cohesive unit. So whenever we're looking at menstrual symptoms in Chinese medicine, we're looking to understand, okay, so which aspect of this comprehensive cohesive unit is not actually doing its job as well as it should. So after the menses, the cervix closes up, this tide moves and starts the flow through the fallopian tubes towards the ovaries. And then as the follicle is growing, the dominant follicle is getting bigger and bigger and bigger, we come towards the ovulation. So this time between the end of the menses and just before the ovulation is phase two. This is the pre-ovulatory phase. And then we have the ovulatory phase, which is usually in most women across 48, 72 hours, usually over 2 to 3 days, sometimes 3 to 4 days. So the ovulation is never just one moment. It's a timing, and of course on the BBT chart we expect to see a plunge in temperature followed by a steep rise in temperature, and that rise should cross over 2 or 3 days. And it's at some point along that rise that the follicle is going to release the egg. And then something quite miraculous happens. So as the egg is released and the fimbriae is encasing the ovary, the tide within the whole of the system changes back towards the womb itself, towards the uterus. And so now we have the tides in favor of helping to guide the egg towards the uterus, hopefully a fertilized embryo if you're trying to conceive. And so that inward tide towards the uterus is then to bring all of the necessary nutrients towards the uterus, as well as carrying that egg stroke embryo. And then post ovulation, we have phase 3. And between the ovulation and the end of phase 3, at the end of phase 3, we should see peak progesterone. And then phase 4 is the premenstrual phase. And so this is the body either preparing to take an implantation and go forward to a gestation, or preparing to flow into the cycle. So did that make sense? Phase 1, menstrual; phase 2, pre-ovulatory; and then a 2 to 3, 3 to 4 day ovulatory phase. Phase 3, post-ovulation; phase 4, premenstrual. So this is the way that we look at the menstrual cycle in Chinese medicine. And we love to use the BBT chart, the basal body temperature charting, to really help us understand the behavior of what's happening within the cycle by looking at the way that the chart is behaving. So I would laud one of our most senior teachers, certainly the woman who has massively inspired me across the whole of my career, Jane Littleton, who is in Australia. Jane was a scientist in her first career and started studying Chinese medicine, 35 plus years ago, and has been our forerunner of really helping to understand how we can use acupuncture through these different menstrual phases. So Jane's been our spearheader, and what we have through the foundation of her work and all the subsequent work from all of my colleagues all around the world, we have a very joined up community in Chinese medicine of people who are studying this, sharing information and teaching each other. And what we have is a very strong clarity of the way these BBT charts look and the way that the line formations actually correlate to Chinese medicine diagnosis. So it gives us a very clear understanding of what sort of acupuncture or herbal medicine we need to apply for this patient according to the way that their chart looks. It's absolutely fascinating.
That's so interesting. And I think when women learn the fertility awareness method, because we all hear things about temperature and how it goes up at ovulation, things like that. And I think it's so interesting because it just interplays, I guess, the way that it's looked at through acupuncture, the way that the chart's looked at through fertility awareness. I think a lot of women expect that their BBT has some sort of predictive value, like, oh, it's going to tell me when I'm ovulating and I should be timing my intercourse based on that. And I think it's really interesting when you find out that it's measuring the body's response after ovulation. I think it's really interesting that after you ovulate, your temperature goes up and all the different things that happen. And I think I think that it's so interesting that obviously in traditional Chinese medicine, especially what you said about the word for uterus encompassing all of the reproductive organs, I think that that's really important because I feel that in regular medicine, regular Western medicine, everything is so compartmentalized that the fact that everything is working together is lost in the treatment, right? It's just not looked at that way.
I I think that in lots of ways, our Western colleagues maybe have just lost touch with necessarily thinking of the behavior as a whole as being diagnostically valuable. And this is to do, I think, something to do with the way that, I want to press you this. I have an integrative practice. So my acupuncture practice is actually based in a fertility unit. We have 5 fertility consultants. We have 3 specialist gynecologists, 2 obstetricians. It's a very, how do you say in North America, OBGYN practice.
Mm-hmm.
I have a huge respect for Western medicine, and I particularly love the fact of how certain investigations and assays can give us so much information. So definitely, please understand, I'm coming from a very integrative perspective. Um, I'm a big raging fan of functional medicine, and I really hugely appreciate the way that this is moving further and further onto the agenda, and is taking a much more expansive use of that ability to assay and really try and make better diagnosis based on a much broader picture. So my criticism of current fertility monitoring in particular is that they're only monitoring 6 or 7 key factors without necessarily really taking the time to understand the subtleties of how minor fluctuations can make such a big difference. And so I think that the way that we help women to understand and improve their menstrual function in Chinese medicine is that through this 360-degree thing of looking at how your cycle is behaving in every phase of that menstrual cycle really gives us a chance to understand what it is we can do to improve it. So you were asking, Lisa, about some symptomology. So I'd just like to kind of give you a sense of the sort of checklist that I would work with every menstrual patient, no matter what it was that she's coming back. I see a lot of women for PCOS, a lot of women for endometriosis.
Oh,
I see a lot of
PCOS. Sorry.
PCOS. Yeah, PCOS.
I always say, I think I hear PCOS so much. I've never heard PCOS. I just want to make sure all the listeners know exactly
Yes,
what you mean.
indeed. Polycystic ovarian syndrome. I just want to be clear that I see a lot of gynae patients as well as a lot of fertility patients. And I work a lot with women who are perimenopausal and menopausal. And so monitoring symptoms is one of the surest ways for us to determine and understand what is it that we actually need to work on. And one of the things I respect most about Chinese medicine is, acupuncture is the 7th form of intervention. That actually in Chinese medicine, food is the first medicine, and that diet and lifestyle are the most important aspects of the diagnostic care that we can give to our patients, and that through a Chinese constitutional diagnosis, we're really able to help people to make the dietary guidelines that are going to help to improve their menstrual function. And I will tell you for free that so many women, their menstrual difficulties are predominantly diet induced. And that this is a huge conversation. I certainly want to direct your listeners to pick up and listen to the podcast that you've done with Angelique Panagos, and talking a great deal about the importance of insulin balance for really regulated menstruation. This is vital and important. Also point them in the direction, please, of the podcast that you did with Mark Sklar, because he's one of my Chinese medicine colleagues and will really help to give you a much expanded understanding of what it is that we can do with Chinese medicine. So when somebody comes in to see me and we're talking about their periods, of course, the first thing I need to do is a good history. And when I'm doing a history with women, one of the things that I'll do is go right back to menarche, which is the onset of the first menstruation. And we're looking at what age was she. And I'm very interested to understand did the cycle regulate relatively quickly? Was she having normal periods in the early part of her menstrual life, or was it a long, slow, irregular onset? I'm always asking about what kind of symptoms did she have as a teenager. And lots of women look at me and they say, well, I can't remember. And I say, oh, that's good, because actually, if you can't remember, you probably weren't having any difficult symptoms.
This is true. You
Anyway,
definitely
so
remember if you were having
what
bad periods or
yeah,
painful or heavy.
exactly. Yeah, exactly. And you would remember also if all your other girlfriends were having their periods and yours hadn't come, you were had quite late onset. You also remember if you were one of the very first girls to get it. You also remember if you had to take days off school because it was so painful. All of these things come up. But one of the reasons that I always start in this place with women is that I think it's incredibly important to understand if we can gain any information about what are the kind of inherited traits about this woman's cycle. And in that context, I also want to know something about, how was her mother's menstrual health? How was her sister's menstrual health? How aunties, grandparents, what do you know about the menstrual health in your family? Oh my goodness. I practiced this on myself. Turns out that my great 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 grandmother, no, even four times great grandmother, was famous in her community for her menstrual rages. And that I sat down, no kidding, I sat down, there was myself with my favorite aunt, who is my mother's sister, with my grandmother's first cousin. So we had three generations, three different branches of the family. And we were going through the Tattersall family album and telling family stories. And you know what came out was this long and consistent story of the horrible menstrual disharmony that is rife in my family.
Wow.
So, it's really important. Well, I would also say that I come to my practice with a lifelong endometriosis and polycystic ovarian syndrome history. So, my own gynae history is 4 sides of A4 in bullet form. So I feel really passionate about helping women to have really healthy periods, because I've spent the majority of my lifetime having very unhealthy periods. And I really feel very passionate about helping to express to women to consider and understand how much Chinese medicine has to offer. I can tell you for free, it revolutionized my life and really changed my menstrual health.
Well,
So going back,
I did this interview with a doctor, a medical doctor, the only medical doctor I've had on the show so far, Dr. Danielle Miller, and she's not an acupuncturist. She received a specialization in something called napro technology, and what it is, it's like this medical interpretation of the woman's menstrual chart. And what I found most
mm,
interesting about talking with her was that through the NAPRO lens, you do what you're speaking of. You go through the woman's cycle. So the treatment is tailored to her menstrual cycle. And you
oh,
do
brilliant.
specific, yeah, it's amazing. You do specific things depending on where she is in her cycle. And so it's a really in detail. It's kind of the best case scenario as far as I'm concerned. Just as you were talking about with how much Western medicine can help you, the diagnostic tools, how they can be used to find so much information. And when you couple that with what's happening specifically in the premenstrual or the pre-ovulatory phase, around ovulation, the post-ovulatory phase, when you do that specific to her, instead of just randomly testing for things on whatever day
Mm-hmm,
you think it should be, how much
mm-hmm.
more information you can gain from it. So I'm really excited to hear about how you treat women in terms of what's happening for them, obviously, with that understanding of the different phases of the menstrual cycle.
Fantastic. Would you please put that reference into the show
Oh,
notes, Lisa?
absolutely. Yeah.
For me more than anybody.
Yeah.
And also at this point, I'd like to also reiterate something that Mark Sklar mentioned in his podcast with you, which is the ABORM, the American Board of Oriental Reproductive Medicine. They have their own website. If you just Google aborm.org, and all through America and Canada, there are ABORM board certified practitioners who have done extensive study to understand treating for a healthy menstrual cycle. So, irrespective of whether you may be looking for a practitioner because you're wanting a fertility practitioner, if there are women listening to this who are having menstrual difficulties, and you're thinking, oh gosh, acupuncture, okay, maybe I will give that a go, then I would very much guideline you towards the ABRM website. They have a fantastic register of all of their board certified practitioners, and that's a really excellent first port of call. These are practitioners who have done a lot of postgraduate study and examination and really understand everything that I'm talking to you about today. So, just coming back to checklists and applying and understanding how we look at this through Chinese eyes, which obviously is resonating with. I'm sorry, say the name of the doctor you were just mentioning and her technique.
Dr. Danielle Miller, and she she is an MD, and she received a specialization in napro technology.
Okay, great. Show notes, please. So, a history is actually really vital for us to understand. It's the absolutely important starting point, because what I need to know is what's normal for this woman. Now, a 28-day cycle is spot on, picture perfect lunar rhythm. But actually, not every woman has a 28-day cycle. And certainly, I would be very happy to categorize anything from 26 to 30 days as normal, as long as that's her really regular rhythm. She always comes on day 29. She always comes on day 30, 31, whatever it might be. If that's her very regular rhythm, then I'm not going to consider that 31 or 32-day cycle out of order. I'm going to consider that her order. And especially as through the charting, we can see that actually the ovulatory phase that is happening right in the middle, that there's a nice concurrence between the length of her follicular cycle and her luteal cycle. So my first protocol is to try and understand, well, what's the regular length for this girl? And so to understand that, I need to go back to Monarch and try to understand, well, how is your cycle rhythm before you might have started any birth control? Then it's also really important to take a fully clear picture of what the birth control history has been, because one of the things I'm very concerned about, I'm not sure that we're going to have time to talk about it today, but I'm very alarmed to see how many young teenage women are being put onto the birth control pill, not for any reason to actually try and prevent a pregnancy, but simply to try and regulate disharmonies, particularly dysmenorrhea, or to regulate the length of cycles. Now, to my Chinese mind, that's completely out of order, because actually what you're doing is you are imposing a false hormonal stricture exactly at the moment when this woman's body is trying to establish its fertile parameters. And you are imposing a restricted format of behavior rather than listening to what the behavior is telling us about what is not quite as regulated as it should be. So one of my real take-home messages from this podcast for all of your listeners, if you're aware of young teenage women who are having a lot of menstrual irregularities, then please, by all means, point their mothers in the direction of this podcast. And, moms, if you're listening, maybe you might want to be thinking about taking your daughters to see a Chinese medicine practitioner to regulate her symptoms rather than using the birth control pill as a regulator.
And I have to interject there as well. So for the listeners who themselves had menstrual irregularities and they're on the pill, 5, 10, 3, 12 years later, if you were put on the pill because your cycles weren't quote unquote regular or normal, this is something to think about as well, because more and more we're all learning that this is a band-aid. It's not solving anything, and it's really putting off the problem. Whatever the problem was that was causing those issues is still happening in the background, and now 10 years later it's potentially a lot worse than it was when you first started. Not to
That,
mention the fact that your menstrual cycle didn't have the opportunity to mature. That's a part of
thank
the
you.
growth process.
Absolutely. This is such an important issue. And that actually, in terms of future proofing your fertility, this is a very vital aspect about if young women are using birth control pill to control their menstrual symptoms or their menstrual length, it's really important that you come off of the pill for an extended time after only 1 or 2 years on it, so that you can give your body the opportunity to establish its own cycle. And I would like to interject and say that certainly I think Chinese medicine is one of the best things to turn to if you have come off of the birth control pill and your cycle is not resuming. Then I think that it's a really excellent first port of call. I don't want to blind you with the Chinese medicine language, but in our Chinese terms, I'm just going to say this, so please receive it in the understanding that this is translations from the Chinese and has strong theoretical basis. The birth control pill in Chinese terms can block both the Ren channel and the Chong channel, and that this blockage in the Ren and the Chong can actually be what's causing the amenorrhea. And so for women who have found coming off the birth control pill that their cycles are not resuming properly, please do think about Chinese medicine. We have this wonderful thing in our toolkit, which may be just the key that your body needs to be able to resume its normal function. But let's not get distracted, because I'd like to come back to really talking about the checklist. So in this context of the history, trying to determine, well, what is the norm for this woman, or what should or could be the norm for this woman? How is the menses behaving right now? So I want to then do a checklist. So what I'm looking at is the length of the cycle. Is it too short? Is it too long? Or is there no pattern? Is there amenorrhea? Is there an irregular ovulation? So there's no pattern because 1 month she's ovulating at 12 days, another month she's not ovulating till 17 days, a different month she's not ovulating till 21 days. So we're looking to understand if there's an irregular ovulation. In that context, I also want to understand, is the follicular phase long enough? Are we seeing a full 11 to 14 day follicular phase, or are we seeing a very short follicular phase? So the value in charting isn't just about trying to determine the best time to have sex. Actually, for free, and I know you've talked about it in loads of your podcasts, the very best time is when you see that stretchy mucus. And so coming back to period symptoms, I want to understand about the level of the flow. So try and imagine 180 degrees from scanty, virtually no flow at all, moving up to a slightly moderate flow, to a moderate flow, to a regular flow at the apex, and then that regular flow becomes slightly heavy, to a very heavy period, to flooding at the other end. So that's the spectrum that I use. And so I want women to be able to gauge for me the level of their flow. I'm also interested to know if they have what's called a stop-start flow, which is a very common syndrome in today's society, where the flow seems to sort of finish on day 3 or day 4, and then there's maybe 24 hours without any movement, and then suddenly another movement of blood. Mm-hmm. So we call this a stop-start flow. This is very often a common symptom. I'm very interested in the color of the blood. Is it too dark, too light? Is it watery? Is it bright? So I actually have in my clinic a whole swathe of paint charts. And I lay out my paint charts, and I ask women to point to the colors of red, going right from a dark chocolatey to a purpley red to a bluish red to a lovely clarity ruby red, and then all the way through the spectrum, moving into something which is far too light, where it starts to get kind of rosy red, pinky red, watery red, and then an orangey color.
So the listeners now are going to want to know if they're normal. So what does normal bleeding look like?
Clearly, anything which is too dark, anything which is too light, is not desirable. So if you think of this as a kind of a 180-degree platform from a chocolatey, blackish, dark, tarry blood at one end to a watery, pinky discharge at the other end. So in the middle, we have this lovely spectrum of nice red. There's just that like
Full
think glass of
red.
Merlot.
Yeah.
I think a glass of Merlot moving over towards kind of like winterberry red. That sort of range I would consider a really nice color of red. So a normal ruby red. Now, again, this is always in the context. If she says to me, oh, well, ever since I was 14, I've had a 26-day cycle. I only bleed for 3 days, and my bleed is normally a kind of a more pinkish color. Now, if that has been her normal bleed her whole life, and I can see that she's ovulating and I can see that she has healthy mucuses, it ain't broke. I don't need to fix it. Do you see? It's not about something being right or wrong.
Yeah, there's no
It's
cookie
about
cutter for every
no,
woman.
no, no, no. So what we do is a very detailed history process where we start to prize apart and understand, okay, what's your normal? And let's bring your flow into its best normal. So coming back to symptoms, we're looking at whether you're seeing any clotted blood. And so if you're seeing that clotted blood, we're looking to see, well, is it looking more liverish, like actually looks like liver, roundish kind of clots, thickish, or is it more stringy and membranous? And then depending on whether it's, or maybe you're seeing both, if you're seeing those clots, are they large or are they small? Are they profuse? Are they minimal? So I'm trying to understand. The clotted blood gives us a really clear understanding of the quality of the endometrium. And so we definitely want to treat that. So I need to understand the ramifications. So I should explain in Chinese terms that, if something is too dark, this speaks to us of a deep stagnation or stasis. Something is not moving, something is being held for too long. This is not appropriate blood. This is very old. If something is very watery and too light, there's a tremendous deficiency happening there. And so too the difference between the liverish clots and the stringy clots, these tell us two different things in Chinese terms. So all of these symptoms we categorize in our Chinese language, and then we have appropriate treatments to help the body to self-correct these.
I have a
So we're
question
all
about clots. So for a woman who does or has experienced clots, what does that mean? So if a woman is experiencing clotted blood in her menstruation, does that fall outside of the normal and healthy
yes.
parameters? And then if so, what, I mean, obviously this is not a question you can answer, but I guess just to give us a general understanding, what could that mean for her?
It depends on, of course, the spectrum of it, the range, and the difficulty that she's having with it. So, another big part of our history taking and the way that we question and help women to learn to analyze their cycle is that we're looking at the correlation with pain. And so, um, when somebody moves clots in their menses, now, if she's always had on day one of her cycle a few little purpley, what I call scattergun, liverish looking clots, and it's always been a part of her day one and it comes with no pain, is this something we need to be overly concerned about? Probably not, because it falls into what is her norm and her regular, and also that it's not causing further disruption. If a woman is having terrible menstrual pain or even minor menstrual pain, any pain is not normal. And let's be really clear about differentiating between pain and discomfort. Discomfort is something which is going to cause you to feel a little bit outside your norm. Maybe just lying down, putting a hot water bottle on is going to make it feel a bit better. You're okay. Pain is actually going to change your facial expression. It might even make you make noises. It might even make you curl over or give inadvertent starts or gasps because there's a stabbing or a throbbing or a gripping or a driving or a grinding or a something sensation that is actually causing you pain. So I always try and help women to really determine, is this just a minor discomfort? It's not comfortable, but it's actually not pain. And so I hope that it's becoming clear that when we're working with women and talking about their menstrual symptoms, we're always working on this idea of a spectrum, and we're also working on the correlation. So somebody who's passing really large liverish clots on a really regular basis that are always, there's always a precursor of a gripping pain, and that the pain alleviates slightly when the clot passes. But the pain is such that she feels that she needs to take a paracetamol. This is pathological behavior. This is not normal. And so I despair that there are lots and lots of women out there who are having this kind of experience with every menstruation, and really all they're doing is kind of a put up, shut up, take a couple of Nurofen and get through it. And actually, girls, you need to pay attention. This is your body saying that this isn't appropriate. This is not comfortable. I'm forming these clots because I'm not actually generating a smooth and efficient menstrual lining. The blood is clotting because the blood is not of good quality, or there's some other factor in your blood chemistry that might be imposing and generating an imbalance that's creating this clotting factor. So this is what we do with the Chinese medicine is we really want to try and unpick this. So and it's not.
Sorry that I keep interjecting, but I just want to make sure, because there's a question that I recently got from one of my listeners that I just want to ask here. And just to kind of speak to what you're saying, I mean, I can so relate. It's really eerie, actually, and strange hearing having this conversation, because when I was, my first menstruation was painful, like my very first one. And I used to actually get clots. I had kind of forgot about that. Big ones. It was really, so it's so interesting. And I had painful menstruation for years, and I'm the kind that you're like the worst kind when you're doubled over in pain. And this might be a little bit too TMI for whatever TMI Fridays, but I would liken my pain, and I'm just gonna say it straight. I would liken my pain to if someone put their hand up my butt and squeezed.
Yeah.
That's how I would liken my pain. It was really so. I mean, for any of the listeners who have experienced that type of horrific menstrual pain, like to the point that when I went into labor, I was like, I mean, initially, like the first stages of labor, I was like, oh, this couldn't be labor. My period pains are worse. So, because I had this question from a listener, and she basically said she's I've listened to the podcast. I'm super interested in fertility awareness, and I really want to learn more, except that I have this paralyzing, terrifying fear of coming off the pill because of my period pain. And I think for women, I know, right? But for women who may have never experienced that ridiculous level of pain, like it's actually ridiculous how painful it can be. I mean, on the floor, like it's absolutely ridiculous. So what would you say to her?
I would say to her very much the same thing I do when I'm working with patients who are coming off of antidepressants, is that one of the beautiful things about acupuncture in particular is that acupuncture is treating function. It's treating how your body communicates with itself. And the most astonishing, just the more I study, the more excited I get, the more I'm in awe of the marvel of the ingenious design of our human body. It is the most gigantic self-regulating machine on the planet. We are so adept at self-regulating. And the more that I study Chinese medicine, the more that I do acupuncture, the more that I teach about acupuncture, the more that I want to really help to impart to people that what we're doing with acupuncture is fine-tuning the communication within your own systems to help to facilitate the greatest fluency to generate optimal, correct behavior. This is what it does. This is why it's such a great stress reliever. Because when we get stressed, what we're doing is our energy systems get all tangled up and we get miscommunications and things are not flowing with ease. And so for any woman who's in this situation, and TMI Fridays, I've been in a space and place where I've turned a pasty greenish, whitish, gray color and been sweating and passed out cold from pain from my menstruation. So I absolutely understand exactly what you're saying, and it's one of the things that I do with women when we're trying to really help to diagnose how to treat her pain. I get her to take incredibly detailed descriptions of what it feels like and where it is. So you heard me use all those descriptive words earlier. It's like, I need you to describe what it feels like and where you feel it. So for women who are afraid to come off of the pill, what I would suggest to you is find a wonderful Chinese medicine practitioner and go in and do several months of work to help to platform your systems so that when you step off of the pill, that you're stepping into a more regulated system rather than coming off the pill and stepping back onto that dysregulated platform.
So a
This is
woman
the
can
same.
actually start the process before she
Yes.
goes off, several months before.
Yes, absolutely. I would probably suggest to women to come to me at least 2 cycles before. And that gives us lots of opportunity. And I would be treating according to the menstrual phases during each of the phases, even though she's being regulated by the override of the menstrual pill. The birth control pill. I'm still going to be treating for maximum fluency in each of those cycles, and also gives me a lot of opportunity to work with her from the basis of her constitutional diagnosis. It gives us 8 weeks to really streamline diet, because actually for a lot of women, these kinds of symptoms, bad clots, bad pain, terrible breast symptoms, horrible fluid retention, menstrual headaches, so many of these symptoms are diet related. And so I can work with women, and as will any and all of my colleagues. Food is the first medicine, and Chinese dietetics is a foundation in our medicine. And so one of the things that we can do whilst you're still on the birth control pill is really help you to streamline the diet so that as you step off of it, you're already in a really clarified space. And gluten, sugar, caffeine, alcohol, these are huge problems for our liver function. And it's the liver in Chinese medicine, liver, inverted commas, governs the menstruation. It governs the smooth flow of blood in the body. I hope this is giving you some sense of the way that we are really approaching understanding how to treat each woman's individual um, um, experience of her menstruation, whether she's on the pill or off of it. So we're also very concerned with now. I always forget. You say PMS, don't you?
Yeah,
Premenstrual
premenstrual
syndrome.
syndrome or
Okay.
premenstrual dysphoric disorder. There's a second
Oh
level of
yeah.
it.
Okay. Well, that's the crazy PC world we live in. Hey. Well, over here it's PMT, which is premenstrual tension.
Well, that's not as mean. I like that better than syndrome.
Really, please. Anyway, so of course, a big part of our questioning is breast changes, water retention, any abdominal changes, what's happening to the appetite, what's happening to the bowel movements and the stool quality. We're looking at any urinary changes. We're looking for sleep pattern changes. We're looking at headache. We want to know if there's headache, where is it? When does it happen? How is it being experienced? Are there night sweats, day sweats? Any clumsiness, tendency to bruise, any tiredness, fatigue, heavy limbs, looking for lightheadedness, dizziness, interested to understand mood changes. Is that irritability that's short-tempered and intolerant? Or is it tearfulness and oversensitivity? Or is it that flash anger, like, just get out of my face right now? Or does it come out as apathy, lethargy? Or does it manifest as feeling down, or does it get even worse into a feeling of depression, or the worst of all, into a really sense of a strong sense of black hopelessness? So, and we're looking at those symptomologies, not just premenstrually, but are any of those symptoms coming up around the ovulation? Are any of those symptoms happening, during the menses, or are they happening just before the menses? So when women come to see me, I think they're often really genuinely surprised to see how great a part they're going to take in their own diagnostic process. And I ask for very rigorous notes. And I can say it's, one of the very favorite things about my practice is how often women have fed back to me, oh my gosh, I'm so grateful for this experience. You've taught me so much about understanding my own body.
Mm-hmm.
And I just despair that I wish somebody would invite me to come and write the sex ed
Oh my goodness.
curriculum for teenagers. How do so many women come out of their puberty with so little understanding of how their body works? And so when women are charting with me, we're not only looking at the chart in terms of the temperature. I'm using it very diagnostically to look at the pattern that the chart is creating. We're also monitoring all symptoms, digestive symptoms, sleep symptoms, any other physical symptoms, as well as any symptoms that may be related to the actual menstruation. We're doing a daily monitoring of how the mucus changes are manifesting. We're definitely taking record of how moods are maneuvering throughout the cycle. And then we use this combination of working together to really help her find the diet and lifestyle changes that are going to change that symptomology, and then using the acupuncture to improve the functionality and communication so everything streamlines much more easily. And then in cases where there's really significant dysregulation, looking to understand if we need to be thinking about Chinese herbs as a supplement. And I have to say that I am just the biggest fan of functional medicine nutrition, and that I am referring my patients, almost all of my patients now who are wanting to go down that track, will go for a full-scale testing with my functional medicine nutritionists, so that we're getting a really good, complete 360-degree view of what's happening in their biochemistry. And I will tell you for free, at the very baseline of healthy menstruation, and certainly that is the baseline of healthy fertility and healthy libido, at the very baseline of all of that is the health of your gut. And that the
Mm-hmm.
most important thing you can do is attend to the gut health and the gut balance, and making sure that the biome, that the biochemistry within your gut is doing its job properly. And this will have a fantastic input on your menstrual function. And so, you've brought up a couple of cases, Lisa, but certainly, if I have somebody coming to me who is having very difficult menstrual symptoms, colors and clots that aren't happy, pain that tells us that there's stuff that's going on that shouldn't be happening, mood changes, digestive changes, headache symptoms, breast changes. Absolutely, our first port of call is the digestion.
Mm-hmm.
It's foundation. And so, that's also always my take home message to my fertility patients. The most important thing is your digestion, because, of course, by the time there's an implantation and you move into gestating a full term pregnancy, the saying is she's eating for two, but this is incorrect. Actually, what she's really doing is digesting for two.
Hmm.
And that actually, women who are experiencing a healthy pregnancy are women who have a really good foundation of healthy digestion. Women who are experiencing a difficult pregnancy, there's something that's not right with the biochemistry, and it's probably a digestive foundation. So that's my very first port of call.
Well, your perspective, I just love your perspective, and I love that we're having this conversation for a multitude of reasons. One that stands out is just the conversation you had about mood, and when you were talking about symptomology, how you really look into those different emotional symptoms as well as
Oh,
physical symptoms that women are
so
manifesting. Because when I was growing up, and I'm sure a lot of the listeners can relate, the messages that you would hear about the menstrual cycle were that this is just how it is, and women are just typically crabby or typically annoyed. And so if you experience that, those mood changes, even if they're dramatic mood changes that you experience, you just think that that is the way it is. And I think it's for a lot of women listening to this, it's just so profound to really learn that it's not just
it's
normal
not. It's not
and
normal.
it's a symptom of something that's wrong, right?
And what's interesting in Chinese medicine is that the way that you are experiencing those mood swings and the way that your emotions are manifesting actually takes us very directly to what it is that we need to treat. And so I'll give you a quick example of that is that I don't know if you're all familiar with the fact of the 12 channel meridian systems in Chinese medicine are named for the organs. So the liver system, the gallbladder system, the bladder system, the kidney system, and so on. So all of the pathways and channel systems are named for the organs. And so if somebody's having tearful oversensitive symptoms, I know that I need to really do lots and lots of work with the points that are on the gallbladder channel. And if somebody's having flash anger symptoms, then I know that I'm going to have to pay a lot of attention, not only to to using points on the liver channel, but also to really reinforcing points that are on the kidney channel. And so too with all the symptomologies, depending on the color and the volume and the way that it's being expressed, it gives us exact information about where we need to treat that, which acupuncture points we need to do. So we have this incredibly sophisticated way of actually diagnosing, and so too with the food diagnosis. So all of these symptoms tell us about the foods you need to avoid and the foods you need to emphasize. I'd love to just pitch a note to your listeners. I would really love the chance to talk about all of the issues that our teenagers are going through in this modern internet age. And this is something that hugely concerns me. And I think it's a really valuable program subject unto itself. And if your listeners feel that it's something that they'd like to hear, I'd love for you to feed that back to Lisa, because I would so appreciate the chance to really talk about what's going on for teenagers, not just girls, the boys as well. And this isn't just about menstruation. I just think that what's happening for these kids in terms of body issues and sexual issues and sexual exposures is just so dynamic. And it's the subject that is most gripping my passion at the moment. And I'd love a chance to talk about that. And I'd also very much like to talk about menopause. And the reason I'm bringing this up on a Fertility Fridays program is because actually the way we start preparing for our menopause is according to the health of our menstrual cycle in our 20s and 30s. And then in our late 40s, as we start to become, 42 is perimenopausal. Actually, it's the way that our menstrual function, the foundation of our menstrual function, the foundation of the way we've experienced our gestations and our childbirths and our childbirth recoveries that are really hugely going to inform our menopause. So I think it's massively relevant to your audience to really start taking on board that your menstrual health now is what's going to inform your health during your menopause. And I would like to say, just on the TMI Fridays note, that I have come through my menopause glowing without any, I had maybe one or two little sort of hot, fleshy moments, like literally only one or two. I had one or two nights where I had a bit of a kind of, oh, I'm kind of sweaty feeling. And that was it. That was my menopausal symptoms. It happened like a handful of 3 or 4 times. And that was it. And I have come into my menopause with a marvelously active libido. And I'm really inspired by my own experience of this, and it's something that I really want to share with people, that it shouldn't be a difficult time in the way that our menstruation should not be a difficult time. Neither should our menopause, and so I just really hope that people have picked up a great sense of recognizing and understanding that actually, if you're not having pretty periods, go see somebody who does Chinese medicine, because they'll definitely help you.
Hmm. Well, yeah, no, I think that we should definitely have you back on the show because, of course, there's a few topics that I would love to delve into with you. Obviously, we could have continued talking for the next 4 hours because I would just keep asking you questions. I would just go, but one of my current I guess you could call it a bit of a, well, I guess my current curiosity. I'm curious about everything, which is
Oh,
why this podcast is so much fun
say
for
that
me.
again, Lisa. We just dropped.
Oh, I said I'm curious about so many different topics because obviously this podcast allows me that outlet to really delve into topics that I'm interested in the health and fertility of women, all those types of things. And gut health is one of the areas that I'm really wanting to delve into more in terms of gut health and fertility. And so it's unfortunate that we didn't have time to delve into that today because that would have been a lot of fun. But menopause as well it's a topic that I've addressed on one of the podcasts that I did with Lisa Leger. She's a Justice holistic health practitioner, and she talked about charting through perimenopause and menopause and how the charting itself can inform you. And just like you're mentioning, how having all of these symptoms, although we're always told that that's just how it is, it's not normal, it's not healthy to have an extremely difficult time through menopause. So I'd love to talk to you about those different topics. So we'll have to have you back on the show so we can delve into some of those topics again.
Excellent. Oh, that's so great. Now I'm desperate for you to ask your questions that you've been asking all of your guests at the end, because I've got a huge bugbear that I'd love to air. So please ask me your questions.
Okay, so before I actually selfishly, it's not actually selfishly, it's for the audience. I've had a number of people contact me, a number of email questions actually. So I just want this to be like a brief. Obviously, you're not going to be able to go through this in great detail, but you had mentioned headaches with
Mm,
menstruation, and I've had a number
yeah,
of questions about from listeners who experience headaches either before their menstruation or at some point,
mm,
and it's very consistent. Once they start charting, they see I'm getting these
yeah,
headaches every month around this time. So
yeah.
if you could speak to that briefly, and then we'll go into our final questions.
Sure. Headaches are never normal. And so we would do exactly what you've just said. It's a question of charting them and ensuring that we're understanding exactly when they're happening. And we would add our Chinese medicine recognition of understanding how that headache is behaving, because that's going to give us the most amount of information about how we can use the acupuncture to really change the behavior so that the headaches will stop. But I would always look at a headache which is showing up at a specific moment within a menstrual cycle. So she always gets a headache the day before ovulation. She always gets a headache 24 hours before the onset of the flow. She always gets a headache on day one of the period. When we see that regularity of pattern, then that's very indicative of what's happening with the hormone levels at that particular time in the cycle. So the first thing I would do with my patients there is be looking at all of the hormone markers that we need to assay and understand what are the balances, because something is not in balance. It
Mm-hmm.
also may be related to a nutritional deficiency. So to answer in super brief, I would say that when I'm seeing a headache which is appearing on a specific day of the cycle with great regularity, cycle after cycle, it's something to do with the biochemistry.
Mm-hmm.
And so we would then start to explore, is this a nutritional deficiency, or is this a hormonal imbalance, or both? And
Mm-hmm.
or is one causing the other? So that's
Okay.
how I'd address it.
Okay. No, I think that's super helpful for the listeners who've experienced it and who've had that question, especially knowing that there's something that can be done to address it, treat it so
Oh,
that it's not going to just continue happening
Exactly. And
Cycle after
please, please,
cycle.
please don't believe that, oh, menstrual headaches are normal. No, they're not. No menstrual symptoms are normal. And actually, be very mindful that every time that you bang back an analgesic, I mean, I keep mentioning Nurofen because this is what lots of women do choose because it's anti-inflammatory.
So that would be like ibuprofen or something like
Yes, I
that.
beg your pardon. Yeah, ibuprofen, um, you know, or any analgesic, whether you're using an aspirin or a paracetamol, or should I say paracetamol. Um, sorry, I've been here too long. I grew up in Canada. I grew up on paracetamol, but now I call it paracetamol. Anyway, it's terribly important to recognize that when you take these kinds of analgesics, it takes your liver up to 6 weeks to clear this toxin from your system. It's a block. And so I am absolutely all for whatever you need to get through. If you've got an important meeting that day and you've got to perform, you have a presentation to give, and you have this raging menstrual headache, and in these extreme circumstances where it's really important that you can be clear-headed, by all means. But on the whole, I ask all of my patients to work on an 80-20 basis. Learn the things that are going to keep you in good health, and do those things 80% of the time. So 80 or 90% of the time. So the 10 to 20% of the time when you need something like that, you can afford it. But if you're popping these things every cycle, then you're building up this accumulation of the toxin, and also building up your own body's, your body becomes inured to the messaging that the drug can give. So it's not a solution. And it's stopping you from feeling the headache, but it's not actually making the headache go away. And that means that the reason that the headache is there in the first place is still existent. And you've just added another layer on top of that. So, I'm all for let's unpack everything. Let's take the layers off and let's figure out what's not working properly, and let's find the very best tools. I have two ethos in my practice. One is the path of least resistance. So whenever I'm working with people, I want to find the solutions that work for you in your life, and the things that you can apply that are easy to do and easy to absorb. And I want to help you make lifestyle changes that are actually going to become a better way of living that you enjoy. And my other ethos is whatever works. Does this work for you? Okay, let's go down that direction. Well, I've got this suggestion. Oh, that suggestion doesn't work for you? Okay, let's find a different way to find what works for you. That's always my question with people. Mm-hmm. And I can tell you for free what works for most women: having lovely periods that are non-problematic. Oh my goodness, that works.
All right, well, let's dive into our final questions. What would you say is the most common myth or misconception about fertility that you'd like to see corrected?
Oh, I've been listening to so many of your podcasts, Lisa, and every time this comes up, I always have exactly the same answer, which is unexplained infertility. Right? Do you get this? Is that the diagnosis that's given over in North America?
Yeah, if they don't know.
So I would like to do a little myth busting here and now. There is no such thing as unexplained infertility. This is not a diagnosis. And if somebody has told you that you have unexplained infertility, I urge you to recognize and understand you do not have a problem that is being given this title. What unexplained infertility, this is a big bugbear. Can you hear the in my voice?
Yes.
I despair of it. Up to 30% of couples are told, oh, you have unexplained infertility. And my response to my Western colleagues is to say, A, that's not a diagnosis, and B, that is absolutely not good enough. What you need to be saying to people is, okay, we've just tested a handful, maybe 6 or maybe 8 markers that are indicators of your fertile capacities. And or out of those 6 or 8 markers that we've just tested, it seems like you're in normal range. And actually, all of your fertile markers are telling us you're fertile. So now we're going to tell you have infertility. And I just think this is E star star L S H star T. It makes me so angry. There is no such thing as unexplained infertility. And actually, a lot of people are being given this, and it messes with their heads. And so I am giving every single one of your listeners who has ever been told this permission to just throw that explanation in the bin. It's completely worthless. And what we can replace it with is starting to really work with people to say to them, okay, so all your fertile markers are in normal range, but you're not conceiving. So what we need to do now is work out, where is the subfertility? What aspect of your systems, his and hers, are at a subfertile level, and what are the replenishments that we need to bring in to your diet, to your lifestyle, to your habits, to your thinking? What is it that we can help to understand and change that means that we're going to build your fertility up into the place where a normal conception is possible? So that's my big bugbear. It's a myth. There is no such thing as unexplained infertility.
I love that.
If you've been given that diagnosis, please understand you have a subfertility on some level, and so let's work together and figure out what it is. And it's never one thing. You know, I mean, the final thing that I'd really like to finish on, and this is important for everybody. It's so important for teenagers. It's important for every woman. It's important for every man, all stages, all ages, no matter what. And especially in this crazy modern life we're living, everybody is deficient in rest. And that one of the things we really need to do is learn to rest. And I would say probably more often than not, the unexplained infertility patients who I work with in my clinic, that's probably the most significant reason that they're struggling to conceive, is that they're just not rested enough. It takes a lot of energy to have a baby.
Well, and my famous last question that I ask not every guest, but pretty much almost every guest, depending on their specialty, for women who are currently on the pill but know that they want to have a baby in the next few years, so maybe 2 to 3 years from now, what advice, if any, would you give to them?
Oh, come off it. Absolutely come off it. The sooner the better. Because you need to see if your body's own biochemistry can reinstate your HPO, hypothalamic pituitary ovarian axis. We need to see, is that behaving? And then when the periods do resume under their own steam, how are they behaving? Is everything normal? And you definitely want a run-in to have more than enough time to really build up the replenishments that you might need to have a healthy pregnancy. And this is especially important if you're already in your 30s. It really does make a difference. Having your first baby over 35 is very challenging on lots and lots of levels. That's another whole program and unto itself. And so it's the longer that, as soon as you know that you're going to be wanting to have children within the next couple of years, I urge you to come off the birth control pill. Granted, it's very convenient, but actually the level of protection between the birth control pill and condoms is pretty much on par, as long as they don't split, she says, having had an unexpected pregnancy herself. But it's absolutely vital that you give your own body its chance to resume its own capacities and abilities. And then with everything that we've just talked about today, you have a chance to determine, well, how healthy is your cycle? Because the healthier that your cycle is in its own natural rhythm, the greater your chances of a healthy conception, and more than that, of a healthy pregnancy. It's not just about getting pregnant, it's about being pregnant, about having enough strength and reserve and suppleness to have a really beautiful delivery. It's about having the strength to get up from that delivery and have a really wonderful recovery and enjoy all those early weeks with your newborn baby. We live in a society where women are just absolutely exhausted in pregnancy. They're having these long, drawn-out intervention births because they're too exhausted. And then really, very many women are not experiencing the restful joy that those first 12 weeks should bring. Instead, it's just a dynamic challenge, and they feel exhausted. And we need to help to shift gears, team. Everybody needs to work together on this one.
Oh, well, that's such a beautiful note to end on. Jani, I just want to thank you for the passion that you bring to your work. I just love that fire that you have about these topics, and I can tell that they're close to your heart and that you just love what you do. So thank you so much for sharing your knowledge and your wisdom with the audience today. So maybe we can end by you just... Oh, thank you so much. And maybe we can end by you telling the listeners where they can find out more about you, get in touch with you, the work that you're doing, and the books that you're releasing.
Okay, yeah, of course. My website is acuhouse.co.uk. This is my clinic website, and I'm just in the process, it's not quite ready yet, of a site called janywhite.com, which is where I'm putting much more the social media side of my own practice and stuff. Acuhouse is my clinic website, but you can certainly reach me there. I always have time to discuss with people. I'm very happy to do Skype consultations. And because of my teaching, which is on a very international footing, I'm extremely well connected all over the States and Canada. So, I'm well situated to help you find a really good practitioner in your area. So I'm very happy to receive emails there, acujani@gmail.com. And yeah, the book's very, very excited. It's a 5-book series called the Fizz series, Fizz. And the first book is The Fertile Fizz, which will be coming out in February. And the Fertile Fizz is really all about keeping it sexy while you're trying to conceive, and can easily be described as a very sexy biology lesson. But it's really helping couples who are in that place where not conceiving is beginning to take a very significant emotional toll on the intimacy that they feel with each other and can really affect their sex lives. And so it discusses in very gentle and great detail a lot of the most difficult aspects about what can happen in a relationship when trying to conceive is really getting in the way. I love it. I think it's a really important book, and there really isn't anything else out there on the market that's addressing these incredibly difficult issues, but it's done with great gentleness and is full of really beautiful erotic drawings and some wonderful erotic poetry. So it's got a very twofold edge. The ambition is that you should read this book and actually really want to have that. It's so juicy. But the Fizz is a series, so subsequent books are about birthing, about menopause, about men's health, and for teenagers. And with each of the books, Fizz is really my shorthand for hormones, and they're written to help people understand about their endocrine, and most particularly to understand how stress affects our endocrine system, which is why it's so important that we really talk to teenagers. Our teenage kids are dealing with stresses that they just shouldn't be having. Anyway, I'm not going to get back up on that soapbox. Lisa, you better say goodbye to me, because I'll just keep talking.
Well, Jani, thank you so much. It was so much fun chatting with you today.
Excellent. Let's do it again.
Thank you for listening. If you enjoyed today's show, please share it with a friend. I'd love to hear your thoughts on today's show, so head over to the show notes page and let me know what you found most helpful from today's show. And also, you'll find all the links that we talked about, all the links to the previous podcast episodes and everything. So the show notes page is at fertilityfriday.com/62, so the number 62. You can find me on Facebook at facebook.com/fertilityfridays with an S. You can find me on Twitter at Fertile Friday. And if you enjoyed what you heard today, you can head over to the Fertility Friday Facebook community. So it's fertilityfriday.com/community, and you'll be redirected to the Fertility Friday Fertility Awareness Facebook group. If you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. Also, if you have an idea for a podcast episode or a guest suggestion, shoot me an email at info@fertilityfriday.com. I'd love to hear from you. And if you haven't yet subscribed to the podcast, just hit subscribe so that you never miss an episode. So you'll always be the first one to know when I've released a new podcast. Also, as I mentioned at the top of the podcast, I'll be opening up my schedule in the new year and accepting some clients. So if you're just learning the fertility awareness method and you want a detailed intro from someone who has a bit of training, then definitely shoot me an email at info@fertilityfriday.com to learn more about the programs that I'm offering. And if you and I would be a good fit, we can schedule a 15-minute chat to find out if that's something that would work. So, as always, I appreciate all of you for taking the time to tune into the podcast, whether you're on the go, whatever you're doing. I really appreciate you taking the time to listen and support the show. And as always, until next time, be well and happy charting.